Good morning, students. Today we will see about the liver. Liver is the largest gland in our body. It is present in the right part of the abdominal cavity, right hypochondric region which is present. The superior surface, what are all the relationship of the anatomical position of the liver we can see. The superiorly or anteriorly surface will be present. Superior and anterior surface will be have the diaphragm. Okay, and then inferiorly by the stomach and the duodenum and the hepatic flexure and the right kidney, and will be the posterior part of the liver will be the esophagus, IVC, aorta, gallbladder and vertebral column. Laterally will be the lower lips and the diaphragm, lower ribs and the diaphragm. Okay, so this is about the liver, and it is the position of the liver. If you see the structure of the liver, there are the two lobes of the livers are present, right lobe and the left lobe are present. There are various ligaments are present in the liver. This is called the falciform ligament. This end of this area, it is called the right and triangular ligament and the left triangular ligament. So in between this area is called the coronary ligament. This one is called the round ligament. Those ligaments are what it is doing, it's supporting, it is helpful to keep the liver in its position. Okay, so this is a falciform ligament or there, and it is a round ligament, right? And then this portion is called the gallbladder. If you see the cut section of the liver, you can see this is anterior surface, this is a posterior surface. This is the anterior surface and this is the posterior surface. If you see right common duct, portal vein and the hepatic artery. If you cut the liver, you can see. Okay, so so what is the main functions of the liver? Always this question will be asked in the physiology question. The first, liver will be helpful for the metabolism. Metabolism, you can write about the carbohydrate metabolism, fat metabolism, you can write. And so liver converts, how this liver doing the carbohydrate metabolism? It converts the glucose into glycogen. Glycogen also converted into glycolysis. So liver is the organ. Whatever you are taking, the food, even the glucose will be converted into the form of a fat, it will be deposited. So if you, why this doing, it will be storage also main important function. You can see that there is a small earthquake happen. So many people living, how living after 10 days also they live. So when they need it, they will convert the fat into again into the like a carbohydrate or the, and it will be. So what will happen? But we are not facing any critical situation in life. The liver fully will be depositing of the fat. Understand? So main thing, metabolism. Okay, yeah. So it and also carbohydrate metabolism and protein metabolism. Protein metabolism, it synthesis the plasma protein and leads to the amino acid synthesis and its synthesis of the urea. And also liver forms the most of the clotting factors. Liver is playing very important role. And carbohydrate metabolism, protein metabolism and fat metabolism. It also converts the triglycerides to the fatty acids. That is used for the energy purpose. Understand? And also cause the detoxification of drugs. If you take many drugs and poisons, all get detoxified. And fat metabolism cause the inactivation of the certain hormones. So it also causes the destruction of the erythrocytes. And also liver is helpful for synthesis of vitamin A and also secretion of the bile. The liver is continuously secreting the bile. The bile is really stored in the structure is called the gallbladder. This structure is called the extrahepatic biliary apparatus. Right or not? So the bile is bile from the liver, it goes to the hepatic duct, right and left hepatic duct, common hepatic duct and then common bile duct, and it is opening into the pancreatic duct and the hepatopancreatic ampulla. What is the process of secretion of bile? In a physiology they will ask how the bile is secreted. Simply it will secrete? No. When the food is coming to the small intestine, only bile is secreted. What is small intestine? Duodenum. When the food is there in the stomach, when the food is entering immediately the small intestine are secreting one hormone is called the CCK. Once the CCK entering into the blood, immediately pancreas release the gallbladder. So it will the contraction of the gallbladder. What will happen when the contraction of this gallbladder, sphincter of body will be open. So the sphincter of body will be opening. It will be the storage of this bile will be emptying of the gallbladder. So the bile containing the, what is the content of the bile? Bile containing bile pigments, bile salts, right or not? So it is helpful for digestion of the fat. So the lipase act into the fat, it leads for the digestion. Nearly here we can have one more question again. 20 to 25 bile salts molecules are coming together and it is carrying for the digestion process. So it is not only helpful for digestion process and also absorption of the fat. It's also one of the important one. So absorption nutrients also will be helpful in the small intestine, fat, protein and carbohydrate absorption. So not only metabolism, carbohydrate metabolism, protein metabolism, not only secretory function and detoxicate function, also carbohydrate, protein absorption and the fat absorptions. So this absorption also one of the important one. And one more question, if they ask you in the liver, extrahepatic biliary apparatus, please draw this picture. So you can write it what this, it consists of the part of the part of the storage and drainage of the bile by the extrahepatic biliary apparatus, which is consist of the hepatic duct and common hepatic duct and the gallbladder and the bile duct and right and left hepatic duct and the common bile duct. Are you understanding? So this is about the extrahepatic biliary apparatus. You can 5 mark question you can add. And short notes on gallbladder also you can write it. Gallbladder is like a flask like a structure which is present. It is present in the right lobe of the liver. It is like nearly about 7 to 10 centimeter in length. This portion is called the fundus of the gallbladder and body of the gallbladder and neck of the gallbladder. This is called the cystic duct. Okay, cystic duct and bile duct, common bile duct. What is the arterial supplies of this one? Cystic artery, hepatic artery. So middle 1/3 by the gastroduodenal artery. Okay, middle 1/3 will be by the gastroduodenal artery will be, and vein will be again cystic vein, duodenal vein and portal vein. All will be vein will be drain into portal vein and to the IVC. Okay, nerve supply, gallbladder, extravillar are supplied by the autonomic nervous system. What is the applied anatomy of this gallbladder? Sometimes in the gallbladder gallstones are formed, mainly by the Hartmann's pouch will be formed. So what will happen? Sometimes surgical intervention you have to remove the gallbladder. Okay, yeah. So emptying of the gallbladder, when it happen, already I told, when the food reaches the small intestine, CCK will be secreted. Once CCK will secrete, it will stimulate. Then the sphincter of body will be opening and it will be releasing. Relaxation of the sphincter. Then CCK hormone according to that, and it will be coming and reaching this one sphincter of body open, and it will be vagus stimulation. All these things, the storage of bile will be emptying into the small intestine and it will be helpful for digestion and absorption and storage function. So this is about the extrahepatic biliary apparatus. If a liver, you draw this liver, lobe of the liver and ligaments and the functions of liver. If they ask about extrahepatic biliary apparatus, you write about this one. Next we can see about what is large intestine. Why it is called the large intestine? Large intestines are extended from the end of the ileum and to the it will be in the rectum. It will be like nearly it is less length compared with the small intestine. Small intestines are very larger. Okay, so lengthy it is. Here it's only 1.5 meter in the length. Okay, it is like ascending colon, transverse colon, descending colon, sigmoid colon, and will be the rectum. Those cecum. This is the broadest part of the this one. It is width about nearly about 7.5. Why it is large intestine? Because the width is very big. It is called this one. That's why it is called the this one. This small finger-like projection in this cecum, it is called the vermiform apparatus. Most of the time, 80% of the people will get the function is idiopathic. We do not know what is the function, but sometimes it will be getting inflammations. So it will be burst out to the throughout the peritoneal cavity. So immediately you will go for the surgical operation. This will be position will be 12 o'clock position, 3 o'clock position, 2 o'clock position. There are the various position it will be having. Understand? Okay. Next we will see about what is called the colon. Colon is the first you can see about this all called ascending colon. Nearly it is about the 15 centimeter about this ascending colon. Transverse colons will be the 50 centimeter. It extends from the hepatic flexure. This area it is called the hepatic flexure. It is extending from and it is forming to the splenic area. This also splenic flexure, and it will be extend from the downwards. It's called the descending colon. It is also 25 centimeter in length. It is also from the splenic flexure it is coming. Length will be variable to some individual to some individual. Another one, this is called the rectum. Rectum is a 12 centimeter in length. It's extend from the lower end of the sigmoid colon and to the this one lower end of sigmoid colon and the lower end to the sacral vertebra. It joins together, it is forms to the anal canal. So if you see the rectum, the total centimeter really by the like a 15 centimeter, and it is called, there are various valves are present in the rectum. So this is called rectal ampulla, this is the anal canal, this is the anal sphincter, this is the control, the sphincter. There the nerve endings will be there. When there is, it will go to the sensory nerve ending and motor ending. You will run for the toilet when it is rectum is full. Are you understanding? So there is an internal rectum, upper middle portion, and it also folds the separates. These folds will be helpful to separate the flatulence. Okay, so there are various arteries which are separated. Superior rectal artery is the superior, medial side will be separate, medial rectal artery, then median, this area is sacral area, right? Median sacral arteries also will be coming. Then will be the vein will be superior rectal vein, and will be the inferior mesenteric vein will be presenting, and also will be going to portal vein. It will be portal vein and goes to the IVC. Okay, venous train will be autonomic nervous system supplied through this mesenteric area. Parasympathetic nervous system also will be made. This anal canal is this anal canal with the rectum. This anal canal overall it is called the terminal portion of the alimentary canal. Okay. What are all the problems may be coming? So the anal is a very rich, anal canal is a rich in blood supply. Applied anatomy, sometimes we are checking the newborn baby by the rectal temperature. So when you check the rectal temperature, you have to minus 1 degree because of the rich in blood supply is more present. Then sometimes piles problem, varicosity of the vein will be the piles, varicosity of the internal rectal venous plexus. Sometimes will a fissure of anus, fissure like a fissure like eroding, and it will be joining, connecting with the tear of this anal mucosal and produce the hard stool. Because of that it will cause the pain. Understand? So these are all the applied anatomy, piles, fissure of the anus, and the cancer. If it is the anal cancer or the rectal cancer, it will be growing very, very fast. One of my relative died within 3 months after diagnosing. Every week they will be taking about this much of the flush they will be taking out. The growth is very, what is cancer? There is abnormal proliferation of the immature cells are called the cancers. Okay, so since the blood supply in the very high, like in the lungs as well as in the rectum, any cancer cells will be growing very, very fast. Understand? Okay, what is the functions of large intestine overall? Functions of large intestine overall. Small intestine we have seen secretory function, storage function, mixing function, absorption function, many things we have seen. Large intestine mainly, there are millions of the bacteria also present in the large intestine. They are all the good bacteria. Sometimes you take more antibiotics, these bacteria will be dying. So that time doctors will be giving some probiotics one. So understand, these bacteria will be synthesis of vitamin K. It is playing a main role. And also it helps in the absorption of the water mainly taken place, salts and the water. So these bacteria will be helpful to produce the vitamin K. Okay, yeah. Then excretory matter. This we are telling chyme. Once it is coming over here, this one it is called the fecal matter. Okay, understand? Okay, now we will see one glance about what is applied anatomy or the disease of GI tract. The disease from the mouth, what is called? It is called gingivitis, stomatitis, thrush will be there, angular cheilitis and gingivitis and tumor, squamous cell carcinoma. The tumor mainly by the squamous cell carcinoma, and also by the developmental defect will be there. Okay, in the stomach or the cleft lip or the cleft palate, congenital defects will also present in the digestive tract in the mouth. And the esophageal atresia will be there. Yeah, obstruction of the esophagus, hyperacidity. Okay, mainly by the hiatus hernia. What is called hernia? We have seen this is called the digestive system. There will be the loosen, the portion of will be protruded from that, the loose area of the area. So that one it's called the hernia. Okay, when the doctor will be make the patient to lie down, ask the patient to cough. When the cough, that will be suddenly in the inguinal region, inguinal hernia. Okay, so according to that it is namely. So what will happen if you are not doing a surgery for hernia? So sometimes there will be deposition of food materials or necrosis. Anything may happen, infections, or sometimes it may lead to some cancers also. Okay, then will be stomach, acute gastritis, chronic gastritis, peptic ulcer, duodenal ulcer, and also the tumors. And will be the intestine, appendicitis as I told, and typhoid fever, paratyphoid fever, and cholera. And in the sigmoid colon, diverticular diseases, large intestine, ulcerative colitis, hernias like inguinal hernia, diaphragmatic hernia, femoral hernia, umbilical hernia. Volvulus is nothing but the twisting the lobe of the bowel causes the gangrene. This also causes the intestinal obstruction, right or not? And also the liver, applied anatomy of liver. Liver mainly affected by the hepatitis. Hepatitis A, B and C. The waterborne, this is all the blood and other things. Blood through the blood also it will be transmitted. Okay, and in the gallbladder, gallstones, cholecystitis, jaundice, liver will be affecting jaundice, and fatty liver, you can tell fat deposition more in the liver because liver storage function. Liver will think that this fat will be helpful. When the person is starving without food, I can convert into the food, right? So they will storage function. So the fatty liver is also, but our people will be every time taking much calorie, drinking more alcohol, all converted into form of the fat. So the fatty liver, and then if they are not treated, it will end up in the cardiac diseases. These fat will be started to deposit in the walls of the arteries and veins, right? Then they may get the cardiac arrest. So the fatty liver is the primary level. If you control fatty liver, you can prevent the cardiac diseases. So these are all applied anatomy. You have to see jaundice and liver failure, cholecystitis, diabetes mellitus, and the obesity. Why diabetes mellitus? I told you. Why diabetes mellitus? Pancreas is the one secreting various cells, beta cells, right? What pancreas will be secreting? Alpha cells, beta cells. So islets of Langerhans from the beta cells are secreting the hormone is called insulin. This insulin secreted hormone much essential for the cells to take glucose into it. If it is a cell, it does need glucose. Cell is needed to do work, isn't it? Otherwise we will be feeling weak. But cell has to be lock has to open, the insulin only will be open. If the insulin is there in the cell, only glucose will be absorbed. Or else what will happen if they are not secreting insulin? Glucose will not enter into the cells. So the blood glucose level will be increasing. Then the hypothalamus will tell the kidney to excrete it. The blood glucose level. So many problem will occur. This condition is called the diabetes. When there is a cell, there is a defect in the secretion of the pancreatic cells, is a diabetes. This is called the type 1 diabetes. But the pancreatic islets of Langerhans secreting the correct amount of the juice, but the juice is not absorbed with the defect in the cell. That is called the type 2 diabetes. Understand? Okay. So this is about the small overview. 3-4 videos I put it because one video, I know the listening capacity is very less. Just listen. And one idea I tell you that whatever they are asking, you draw the picture. That is why I motivate you, all the pictures you have to draw in your record notebook, and at least you mark it. That will give you to, right? Anatomy means you have to draw the structure and mark the parts and please explain it. Thank you so much.